And greetings out there in podcast land, and welcome to Nuanced, the show that brings you a nuanced exploration of Israel, the Jewish world, and beyond. I'm Benny Shoulder.
I'm Dan Pfefferman. We are thrilled to be here with another episode of Nuanced.
Before we get going, I'd like to give a shout out to our audience watching us today on Facebook Live. Thanks for tuning in. And for those of you listening on Spotify, Stitcher, Apple Podcasts, and all the other podcast platforms, know that there's a live video version of the podcast, which you can check out weekly, available here on our Facebook page, facebook.com/Nuanced Podcast. Check it out when we record or watch all our episodes on our YouTube channel, Nuanced Podcast, as well as our website, www.nuanced.com.
Also, make sure you are following us on Instagram. We are at Nuanced, and on Twitter at Nuanced Podcast for all the updates. And as always, make sure to subscribe to Nuanced on Spotify, Apple Podcasts, Stitcher, wherever you listen to your podcast. And there are rumors out there, I've decoded them from multiple languages, that say it makes a difference if you leave a 5-star review. So please go ahead and do that.
All right. Dan, episode 52.
52. All right. Does that mean we have done a year's worth of episodes?
That means that if you're paying attention, we've been doing over a year's worth of episodes because there were a couple of bonus episodes thrown in the mix. But this is officially, if you're counting weekly, a 1 year of Nuanced. And we're excited to be back with some of with one of our original guests on the show, Dr. David Manheim, who Dan will introduce shortly. But I got to say, I'm coming at the tail end here of a really nice time spent in the U.S. Actually speaking to you from Minneapolis, Minnesota, and I know Dan is set to go out on a sort of a work trip in 2 days, right, Dan?
Yeah, but let's hear about your trip first and your experiences, and then I'll dish about my upcoming adventure.
Well, I could just say that it's really, really good to be out of out of the house after so long spent working from home and being at home and kind of getting a change of scenery. And it's always nice when you're in a place where it's, a little bit cooler than at home and greener. You know how it is, Dan. But it's been nice. We've been spending some good time with family. We've been spending good time with friends, a lot of good meals, a lot of good fun. But, like all good things, it's going to come to an end. So in a week, I'll be back home. And
we've missed you here. But as you come back home, I'm getting on a plane and going to the States.
Cool.
I'm going for just over 2 weeks. I'm bringing the first ever, as far as I know, and I'm going to bill it this way because it sounds better, first ever delegation of Emiratis and Israelis, and we have a Saudi joining us for my new job with Sharaka, the Gulf Israel Center for Social Entrepreneurship. Sharaka means partnership in Arabic. So we are going to spread the word. We have a new narrative, a new story, a positive story about the Middle East that we can work together. We're flipping the script. So we will be heading out to New York, Boston, and Atlanta. And then I will be joining my wife and kids in Omaha, Nebraska, where we'll hang out with the in-laws and her siblings and all that stuff. So
good times.
Definitely looking forward to that. But we've got some guests with us today. We've got here Dr. Rami Shanani, who's sitting in the studio in Rehovot. And we've got Dr. David Manheim, who would have been in the studio, but he's not. And
like I said earlier, Dan, David Manheim was guest number 6, episode number 6, way back when, sometime last year at the beginning of the pandemic, when we were all kind of thinking that it was going to be the end of the world. And David kind of, I think he was, I don't know, he was a little bit, he relaxed me. He calmly looked me in the eyes and he said, the world will keep on spinning and it'll be okay. And indeed it has. Dan, why don't you introduce David officially for people that aren't as familiar as we are?
Gladly. So we have back with us, like you said, one of the originals, Dr. David Manheim, post-doctoral researcher at the University of Haifa's Health and Risk Communication Research Center. We hope this is all accurate, by the way, from the last time, because we're just rereading your bio. Works with universities, NGOs in the UK and US, and focuses on modeling test and trace programs for the UK, policy options for COVID-19 in the US and internationally. And before that, he worked on understanding and mitigating global catastrophic biological risks, including work on bioweapons, natural pandemics, and other disasters with groups at the University of Oxford, such as at the Future of Humanity Institute, which was one of the coolest things we've ever discussed on the show, and other various nonprofits. He has a PhD in public policy and decision theory from the Rand Corporation. and has worked on various issues informing policy decision-making, from infectious diseases such as COVID to modeling risks for earthquakes and other natural disasters. Welcome back, David. And we also have with us Dr. Rami Shanani, who happens to be a friend and a neighbor, and we go to the same shul together. But he is a brilliant and interesting, I know, surprised you, physician, family doctor here in Rehovot, studied at the Hebrew University Medical Center, and everything that David does, how we say, from 30,000 feet, Rami does on the ground, working, dealing with Israel's public health system for the Leumit, HMO, I guess that's how you'd say it in English, the Leumit HMO. And in addition to working as a doctor and having dealt with COVID for the past year and a half, he's also a major in the IDF Reserves, where he serves as a commander of a medical unit and is active in civic and communal leadership roles. So welcome both of you to Nuanced.
Welcome to you.
Benny, why don't you kick us off?
So I got a little bit of feedback noise in the back. You'll have to excuse that. I think they're building a new building down here. The biggest thing that I think that has happened to me over the course of the past month is that I've left the state of Israel and traveled to another country. And, obviously that's, a big thing after not having been around any, out of Israel in a year and a half, but also you get to experience how people in different parts of the world are experiencing this pandemic, and to hear their perspectives and to understand more and to just see with your own eyes how it is to be going through this in a different place. And David, I don't know, or Rami, I don't know if you had time to be in the U.S. in the past year and a half, but it is quite different than in Israel. And I think that I would try to think before the show how I could explain it, because it's not as easy as just saying the Americans are idiots. They're traveling, they're handling things differently, because it's not good to generalize 300 million people. But what I can say is that I'm not saying that. But what I am saying is that, it seems that there was a great deal of politicization of the pandemic here in the United States, especially during the Trump administration. And that if you were on the liberal side of things, you were extraordinarily cautious. And if you were on the conservative side of things, you were less so. And it seems that once the administration changed, and once you had a lot of people who were vaccinated, people slowly were able to, even if they were on the more cautious side, it was like a switch flipped in their head. Whether or not that's accurate, medically speaking or scientifically speaking, it just seems that if you were vaccinated, you were cool. And that was the attitude about it. And it wasn't necessarily that you were cool that you weren't going to get COVID. It was cool that if you were going to get COVID, you weren't going to die from COVID. And therefore, we're going to treat this like any other sort of respiratory thing. And if you're not going to die for it, and if you're going to be okay, and if the majority of people are vaccinated, let's go back to live our lives and go to restaurants and go out and play with each other and meet with each other and so on and so forth. And that seems to be the attitude here. You don't see a lot of you don't hear the naysayers that used to be out there in the past shaming people about wearing masks or not wearing masks or so on and so forth. And you don't experience a lot of closures, and you don't experience a panic in the press about every day counting the amount of COVID cases that there are, or how many people are in the hospital, or the narrative seems to have shifted. So I'm wondering where we are in Israel compared to that, because there seems to be a sort of a difference between how the nation and the body politic and the psychology of the Israeli handles COVID differently from that of the American. And are the Americans right? Are the Americans wrong? And where are we with the virus? And I know that there's a lot to unpack there, but I kind of want to sort of use that as the intro, because a lot of our listeners are coming from the United States, and they might not understand the dynamics in Israel. And I'm coming from Israel, and I didn't understand the dynamics in the US when I got here. So that's the base of the context here.
So maybe, Rami, let's kick it over to you first of all, just from an on-the-ground perspective of dealing with it here, dealing with the public. How do we deal with it here? What have you seen? And kind of where are we at this point in time with COVID?
Okay. I think that something to begin with, maybe it's a good idea to describe a little bit the way that the Israeli medical system works. Because the Israel medical system, it's a kind of a national medical system. Every Israeli is insured by the government. It's obligatory. There are like 4 HMOs that they are subcontractors of the government to supply the medical service. And I mean, we have all around the country spread around. We have clinics that are for primary medicine and secondary medicine, and we have spread around also some medical centers, hospitals. Some of them are very, very good in the I can say even in the Ivy League of medical system, medical centers in the States, and some of them are more regional, but they are still in a good medical level. Now, as a country that all the time also prepare itself for, I can call it the security events, Israel all the time was like on the spot, preparing for a medical, for biological event, for chemical event, but it was all the time with a kind of an attitude that it's something that it's between us and our Arab neighbors, and always we'll be able to reach out for our great friend, for example, United States, to help us in a case of a pandemic or a local pandemic.
Yeah, I don't know if people know, but we used to, until, gosh, when I made Aliyah, when I moved here in 2015, we were still getting gas masks. Okay, so people outside of Israel, we still have them, right? We still have them, but I don't have one for my youngest kid, for example, right? So yeah, what you're saying is, I mean, we used to
maybe you
have
should.
this ethos of national preparedness.
So it starts
right?
from the local citizen, and it's reached to the biggest center and system altogether. In Israel, at least once a year, there was a kind of a drill that all the parts of the system were taking care of, taking part of, with hospitals, fireworks, police departments. All the parts of the system were practicing biological event. And one of the things that was surprising for me was that when it happened, they didn't really operate it according to the drill, according to the plan. Usually the plan says, okay, we have the best trained people are in the army, and in such a case that it's a kind of a national disaster, let's say earthquake, so the army is taking care of the whole thing, is like the envelope operational system, and all the other systems are like kind of a joining venture together with the army. And here, as somewhere at the middle of the way, the health ministry took over, and it was quite surprising. And I think that it caused quite a lot of mess at the beginning, because really the health ministry wasn't trained enough to be a case manager for such a big event. And the army was very frustrated that they are not operating them. And the citizens were kind of mixed up what's going on. I mean, they got all the time different messages from different people that were in the position. So that was the very, very beginning. But since we have a kind of an organized medical, national-wise organized system, so it was much easier to start to set up the systems all around. And the first thing that we done was that they divided between the very severe patients that needed hospitalization, and all the others that were able to stay at home. All the people that stayed at home were, the 4 HMOs were in charge of them, and they were being followed up by their personal doctors or by special teams that the HMOs created. And as long as they were fine after a few days, that was also something that was changed through the time, when all the World Health Organization was learning also about the whole story. So at the beginning, we needed to have like 2 PCRs negative before you were telling a person that he's not infective. And nowadays, we are waiting 10 days. And if you are symptom free, you are free to go. So things were changed all through the time.
And you think we more or less reached a place where we're managing it effectively now?
I'll give you an example. Okay, now we are in the fourth wave, and the fourth wave started somewhere like a month ago.
Right.
We were. I'm also part of my HMO follow up center for those patients that are staying at home, and we reached a point that we had like dozens of patients that were still active. And then in 2-3 weeks, it's like a boom. Nowadays we have, I think, around 600 to 700 active patients right now at home. But our control system, it's much more organized. I know each of those patients, what is his condition. I can already mark him few days in advance if he's going to be released in few days and get his free pass back to civilization, or he'll have to stay at home. I can send medical teams for those that are starting to get worse and to send them also to hospitals. So as if I'm looking from my point of view, from the community of system, we are pretty nice organized and we are on it.
David, you want to take us on the global level?
Yeah. So there are a couple of key points. The first one is there's a tremendous gap between the developed world that mostly has access to vaccines. Certainly, the US, the UK, Israel, to a somewhat lesser extent, the rest of the EU. Other countries are having more or less problems with the vaccine rollout. But as they get that done, I think the critical thing that changes is the disease is less serious. People with the vaccine are less likely to get COVID. They're also, the cases are much less serious, and kind of consequently, or even more so, they're less likely to die of it. We also have a pandemic in the rest of the world. It's hard to control a pandemic. As we know, we definitely saw this. It's really hard to get everybody to stay home. It's even harder in countries that don't have kind of the first world amenities, and it was relatively easy to stay at home when you could get your groceries delivered and work remotely. A lot of countries in the world, that's not a thing that can happen. So the rest of the world is still really struggling with COVID. It's a very, very serious thing still, and until things get more under control, that will, until we need 16 billion doses of vaccine to get everybody in the world. That's a lot. We're slowly getting there, a little bit too slowly, but fine. That's kind of the ongoing state of things. As the vaccines are available, we start seeing the key dynamic shift, and this is happening to some extent in Israel, to a much greater extent in the US, which is vaccine hesitancy and people just not kind of, I think in Israel especially, because of the way that it was done by age, younger people mostly got vaccinated, but there's a fairly large contingent that just kind of said, oh, well, things are under control, I don't need to bother. As case counts started going back up, a lot of them have changed their mind, but there's a contingent of people that aren't interested in getting vaccinated. In the US, obviously, I think the key difference, and this relates to what was said by Dr. Shanani before, but I think there's a big difference between things being political and politically charged, which they certainly are in Israel. Nobody will say that Israel does not have a very politically charged and divisive society, but that doesn't mean that everything has been politicized. It doesn't mean that people's viewpoint about COVID depends on who they voted for in the last election. Certainly not to the extent that it is definitely the case in the US. So I think that the US is still struggling now, and people are treating it much less seriously. And there's a view that I think is reasonable, if unfortunate, that among people who are vaccinated, that if you're not vaccinated and you get sick, that's your problem. And there's a kind of view that among people who aren't vaccinated, that it's just not that serious, and most people, especially younger people, don't get that sick, and very few die. And that's somewhat true, though 50 people died yesterday in the US from COVID. And that's not, I had a friend who was saying, you could measure the number of COVID deaths at one point in September 11th size events every day. There was a time when that's the level of what was happening. And he said it was great to see it get down to the level where it was only a passenger airline full of people dying every day, but that was still horrific. And 50 is much, much better, and it's still 50 people dead. I think there's a big difference. Another big difference between Israel and the US is kind of in economics and public policy. We talk about the value of a statistical life. Like, how much money is it worth to spend to, on average, statistically save one more person? And kind of at some point, you have to say, like, we could set the speed limit on the streets to 10 kilometers an hour. Nobody would ever die in a car accident. It would be great. And it would take you, instead of taking an hour to get to work, it would take you 3. There's a trade-off. We can't make everything completely safe. I think that there's a really big difference in the in people's view in Israel about what it means for somebody to die of a preventable disease, for somebody to die in a traffic accident, for somebody like the country has a very different view. And I think that leads to how seriously they're treating COVID now, even after on an objective level, the risk is thankfully much, not zero, but much, much lower. So I think that's kind of the current state of things.
You kind of teed it up, but I'm curious, and I can pose this to both of you. There is a very big difference into how each respective society is dealing with the virus in terms of how it imposes restrictions or builds or enacts policies and regulations that are meant to protect public health at this stage of the virus. And it seems that, at least in terms of what you read in the press or the overall feeling of things, it's in Israel, you very quickly jump into a place of, are they going to lock down? Are we nearing a lockdown? Is that something that's on the agenda of something we can expect to see, in the near future? And without trying to simplify things too much, I think that in Israel there's sometimes an attitude in terms of government policy or in terms of the government itself, that the government kind of takes the role of like the mom and dad, and we expect you to step in and tell us how we should be behaving, and we'll do whatever you say. Whereas here in the United States, the government kind of says, we've given you these tools and we've given you this knowledge, and the healthcare system is managing by and large. So therefore, exercise good judgment and live your lives. And we hope that you prosper. And you can kind of see that play out in terms of where Israel might be right now at this juncture and where the US is at this juncture. Whereas in the US, and unfortunately, like you said before, a lot of this does get down to where people are saying, well, I'm vaccinated, so if you're not and you get sick, that's your problem. Airports are packed, restaurants are packed, people are going out living their lives. There is no green passport system. There is no restriction in terms of who's leaving or entering the country so much. And you could really be somewhere and say, you know, it's very hard for me to see that there even is COVID, except for a couple of people walking by that might have masks, and maybe they're immunocompromised, or maybe they're just very, you know, cautious about it or whatnot. Of course, there's the economic impacts. You see a lot of cities that are kind of, you know, the urban core has been decimated by COVID, or people aren't showing up to work in the offices anymore in a downtown area, and what that does to a city. But we'll put that aside. And then in Israel, it seems like, you know, every day you open the paper and it's doom and gloom. You know, what's going to be, what's going to be. And I'm curious if where Israel's approach is, take psychology out for a second. Is the approach in Israel better or worse, or more accurate, I should say, to where we are at this stage of the pandemic? Or is it more reflecting of the human psychology of Israelis?
I'll throw in just another question before we hand it over to you guys. On top of that, Israel, America, are there, and we can bring in other countries' approaches, and if they've, you know, nailed it, you know, better on the head. So I don't know if you want to jump in,
Okay,
your thoughts on
I'll
it.
try to give 2 cents of my thoughts. First of all, you know, you forget that United States has a very big neighbor from the north, and they have also a national medical system, one, Medicare, and they did so well during the pandemic. But if you look at their approach, it's
For the geographically challenged, he's referring to Canada.
and if you look at their approach, it's more similar to Israel than the States. They were very much fatherhooding the citizens, and I'm not sure that still in Toronto there is a kind of lockdown, but they have a lot of restrictions till now, and they did well also with restraining the pandemic. This is we're talking about something new, something that really we didn't have an experience with for the last for sure for the last few centuries. Some will say that the last pandemic that you can compare it to, it's the Spanish flu from the beginning of the last century, and you can't really compare it because we weren't a global village, and we didn't have any means of treating that we can do today. So I don't know if you can compare it. And the second thing is that we have a lot of leaders, governments that are pretty much afraid to take a stand. They are letting experts. You know, I'm enjoying for a year. I'm enjoying looking at the TV shows to see so many experts know exactly what's going to happen and how to take care of this pandemic, and I'm getting it, you know, from the experts to my to my patients that are also becoming like an experts. And I got only a few days ago like a list of 5 different vitamins or supplements. What should I take to make my symptoms shorten? I mean, meanwhile, we don't have.
Do any of those work?
Um,
We had a guest who told us that zinc, but only a specific kind of
that
zinc.
was one of the supplements. As a matter of fact, I saw few hospitals in Israel that use zinc at least for a certain time of the disease. People are learning about protocols, how to take care of patients. And you know what? If I'm mentioning it, this is something that I'm thinking in the past few months. I think that that the leadership is right now, because there is a vaccine, became kind of dedicated now only for vaccine. Go and vaccine you, so everybody should vaccinate themselves, and that's going to be like the miracle cure. But it's not a miracle cure as long as you are global village. And that's what happened, for example, in Israel. So we got vaccinated most of the population, and we had a great honeymoon. And then another variant of the virus came, and we are suffering from another wave. Yes, maybe it's little, maybe it's milder than the the waves that we saw before, but it's going to happen because as long as we have Brazil and South Africa and India, that the pandemic there is like spreading like
wildfire,
fire.
yeah.
So we are going to have some more variants, and I think that we need to add to our look for and discussions of creating new protocols of taking care of patients, new drugs that are as a matter of fact, I know that there are a few drugs that are at a very, very advanced stage of development and that they show very, very interesting results. So I guess that at the very end, when you are going to be, for example, Prime Minister Bennett, or you are going to be a President Biden, and you'll know that you have this kind of protocol that 50-60% of those that are right now ventilated, I can cure them and I can save them from death, and I can save also my medical system from being blocked by these people. Yeah, probably we are going to see a very different approach and a very different behavior in the national and the global wise matter.
So I want to kind of first address that last point and then get back to something Benny said. So the thing I want to say is, zinc, vitamin D, vitamin E. There are clearly studies that show weekly that there is some level of effect. Now, I want to clarify because I think the statistics and the kind of substantive piece here is hard to understand. If you give 50 people a drug and 50 people don't get it, and 25 of the people who get the drug recover, and 30 of the people who don't get the drug don't recover, and so so like it's 5 more, and there's some indication that it's doing something, and that's what we have evidence like that. There's it's a little bit better if you have these things, but maybe if we quadrupled or quintupled the number of people, you'd notice that this is statistical noise. And even if it's not statistical noise, these aren't miracle cures. Vitamin D and vitamin E and zinc are not going to change it from, well, you would have died, but now you walk out of the hospital in a day and you're fine. Like that's just not, that's not how any of these things are going to work. Some of the medicines are a little bit more like that, but none of them are miracle cures either. Nobody's talking about drugs that you give somebody on day 2 of COVID and they stand up the next day and their lungs don't need time to recover. And like, that's not something that we have. It's not something that we're looking at. It would be tremendously different if we had something that changed, that made it 50% less bad. There are definitely things that have the potential to do that, but what we have now is not like that. And that's been true the whole time. We had lots of discussions about lots of different drugs, about what they would and wouldn't do. All of them have been kind of marginal in terms of how much they do. So I want to kind of throw that out as a caution for people who are like, oh, I'm going to do this and it'll be fine. There's one thing that we have, of course, that does function as a miracle cure, and that's the vaccine. Like, we got incredibly lucky. People were really concerned that it would take forever to get a vaccine and we didn't know how effective it would be. And we got really, really lucky that the vaccines are all fantastic compared to what we thought was going to happen, and we got them much faster.
And they give me really good
so
cell phone
that's on
protection, too.
David.
Yes. Yeah. The masks
For those who are
have
listening,
a
put mask on
really,
his
really
face.
strong. Yeah. Masks have a strong protective effect. They're not perfect, but yeah, they're about as much as you can do. And I think that this is one of the places where, yes,
as
right.
As 2 people are having masks, so it's not only that you are protecting yourself, you are protecting the other to get the virus that you are carrying.
I remember last year on Rosh Hashanah when we were having services, and I had a scare that I had COVID. And I actually went to you, Rami, and you first of all, I went and got tested, but you said, if I'm wearing my mask and other people are wearing their masks, and on top of all that, we're outside, the chances of spreading COVID or catching COVID are literally next to nothing. That was very comforting. Certainly calmed me down, as I had to be around hundreds of people, although outside for the high holidays last year.
David, you mentioned something.
Being outdoors is also.
David, you mentioned something that you were going to go back to something
Yeah.
that I had said. Maybe it was about the context of
Yeah.
how societies are handling the pandemic relative to this
Israel
stage
versus, right.
of the pandemic.
Yeah. So yeah, I think you asked, who's handling it correctly, and I think the point that you made about what people expect of their governments is critical. Or is the government a parent that tells you what to do? I have young children. I know Dan has older kids. There's a big difference in how you treat, small children. My kid is almost old enough to cross the street by himself, and we need to make sure that that's safe, and we need to coach it. There's a very different set of things that I insist on, and I'm hoping that Dan's kids, the older kids, are just able to go places on their own because they're responsible, not adults, but they're able to make decisions. Yeah. So I think that to the extent that government is supposed to be a parent, that's a social choice. I don't know that there's a right or wrong answer in terms of how you do that. I think if you hire an accountant and you say, I want to make sure that I, don't break any laws when I file my taxes, I don't go to jail for this, and they say, yeah, maybe it'd be a little bit better if you declared this income. You'd say, you're supposed to tell me what to do. I hired you to tell me what to do. If the government is supposed to have the role of telling you what is and isn't safe, if that's your view of what they should do, then they need to tell you. They don't need to well, maybe, it'd be good if people wore masks. That's, but if you ask your friend who's an accountant for an advice, their role isn't to tell you, no, you must do this. Which relationship is correct?
Right.
It depends on what it is you expect and what you want.
Right.
Different governments have different relationships with their people.
And sometimes you see here in the States, they'll put out a COVID mask advisory. They won't make a decision. They'll say, we advise people to do this, and then people don't do it, or they do it. But I think what I'm more getting at is,
and
Americans seem just more adverse to being told what to do in general.
Well, no, I mean, I think what I was getting at is more, if you have a society that has a vaccine, and the vaccine makes the risk of COVID far different than it was when we spoke a year ago, when we just didn't know, and you have a majority of people who have that, and you're based with an uncertain future where you don't know how many variants there are going to be, and every year there may be more variants, and it's a virus, so as Rami would tell you, it evolves consistently and constantly, and that's kind of the only thing that you really can say for sure about it, is that it will continue to evolve because it is not extinct. At what point do you say the government should take on a more advisory role, because the majority of the population is in 2021 different than it was as they're vaccinated than they were in March of 2020, and therefore it may not be the best thing for a country to be telling people stay in your home by law, or don't send your children to school by law if the children are vaccinated, and which they aren't right now, and we can talk about that later in the show. I guess where this is coming from is just, I'm concerned that, Israel is going to be in this place, as Canada might be, and maybe it has to do with the nature of their healthcare system, and I'm not sure about that, where it's constantly expected to be the mother and father for a threat that no longer needs mom and dad to tell you what to do.
Yeah. So I want to kind of point out. Oh.
No. Keep on.
Go ahead, David.
Okay. So I want to point out, there's a big difference. There's a big difference between when your kid is trying to decide what shirt to wear. They can make their decision. If they wear something that makes them look stupid, then they'll probably learn. If they're trying to learn how to, my kids are little. They want to be able to peel vegetables, and are they going to accidentally cut themselves at some point? Probably. That will happen. But again, that's the kind of thing that happens when you live your life, and that's fine. I don't let them play in the street, when there are cars coming. I don't let them, throw knives at each other. But when the situation changes, I think, Benny, you're absolutely right. And the two halves of an answer are, first, yeah, things have changed and we should treat them differently. And the US couldn't get people to stay indoors when it was bad. They couldn't get people to wear masks when they knew they needed to. So I'm hesitant to say that they have it right now, even if it's possible that Israel's being overcautious.
Right. Rami?
I'll tell you something. Talking about Israel, one of the things that we learn is that to take such extreme measures like how the,
You can say in Hebrew.
no, to have
Lockdowns?
lockdowns.
Yeah.
It's something that you can't really use for a very long time, and you can't use it so often. And also in Israel, it's, as a matter of fact, the government is not allowed to do it by law only for a very certain amount of time, and also it goes immediately to court and to be judged by the laws of Israel. The only country that I can think about that is restricting their citizen by law, and they are doing it in a very, very efficient way, it's China. Mm. And by the way, we don't hear from them how many patients they have every day or every month, and how many people died even at the first wave that they had. So we don't really know how such a way of working, it's working for a very long time. What we know in Israel, for example, we learned that even though you may say that Israel is quite an homogeneous state with the only Jewish and Arab people live in Israel, we discovered that we have some different groups of population with different ways of behavior and responding to even what the government says. We saw how the ultra-Orthodox were behaved in the very, as a matter of fact, maybe till now. We saw how the Arab section was responding for the government restrictions, and we saw how the common Israeli citizen responded. So bottom line is, we need to talk with our citizens with logic, first of all. When you are explaining a person by logic, what are the dangers and how he can avoid, killing his father and mother and destroying his economy and whatever happened during this year. So I think that you are going to get much more collaboration than by pulling and doing some massive restrictions by law.
I have a question. I'm not sure. Both of you are welcome to jump into it, or Benny, you follow this stuff a lot more closely than I do. But now that the vaccine has been introduced, now that in Israel, what percent of us are vaccinated here?
I think that we are around almost 70%.
70%, right? And 70%. I think it's even higher of the people that can be vaccinated, if I'm not mistaken. In America, I think it's about 70% of Democrats and about 50% of Republicans, or something like that. If I was listening to Fareed,
I saw a stat on the news this morning that only 49% of American citizens overall, including children that can't be, are vaccinated at this stage.
So
children, right?
Are we now? I mean, is this the new? Is this going to be with us forever? Are we just going to be living in this COVID reality where we're just getting vaccinated? I know Benny loves these questions.
Well, I mean, Elon Musk is taking volunteers to go to Mars. You can get off this ship if you want to.
Yeah, I'll be okay. I'd prefer to wear a mask. But I mean, is this with us now? Just constantly mutating. We take vaccinations. Maybe one of you can get into the mRNA technology and how they can constantly be tweaking it also for new mutations. I mean, well, what's going to happen now? How do we live with this?
So I want to first, if you go to Mars, you'll also have to wear a mask. Just hate to break it to you, Danny.
Oh, a bigger mask.
But
Helmet mask.
yeah, it's
And
really
all
it's
the
not gonna be,
time.
it's not gonna be more comfortable. Yeah. So I think the question of there was a poll in England asking people how long they want the restrictions to last, and some very large 30-40% of people, I don't remember the exact number, said they want it to last forever, even after COVID. Like regardless of whether there's COVID, they just want people masked all the time. Maybe it's a comment about British people's teeth. I'm not sure, but
Right.
there's
Can only
right,
be a comment
there's
about their
something
teeth.
yeah no, but there's the people's willingness to continue being very cautious indefinitely has dropped a lot. I think that there's no chance that we continue doing this forever, but there's still a question of how safe do we need to be before we say it's safe enough. And part of this, from a more sociological perspective, is people get used to risks. People, it takes time.
We all live in a
but,
country with terrorism regularly, and we've kind of learned to live with it, right?
Right. So I think that there's a sociological piece of like people are still kind of trying to get to the point where they have a kind of well calibrated understanding of the risk of COVID at this point. But yeah, it's I don't think that there's any chance that it stays this way long term. I don't think that there's appetite now, and I certainly don't think that in another year, 2 years, as the world is mostly vaccinated, that continues being kind of a viable strategy. I don't know. Maybe Rami can talk about the vaccine platforms. I'm happy to do so, but.
Not that I'm such an expert, but first of all, I pretty much agree with David. The human being is quite an adaptive creature, and we are adapting for everything. I want to remind you this period of time that bombs were exploding in buses all around Israel, and at that time, Yerushalayim was quite heavily bombarded.
Yeah,
and people kept taking buses. And maybe they were afraid, but they kept living because
you don't have a choice, right?
We want to live, and life it's like the biggest. It's bigger than anything else. So that's the motto that I can say. What's going to happen? How we are going to deal with it? We'll adapt to it. We'll adapt to it. Even we're adapting now. Also, a lot of us already adapted, and we're adapting. We're adapting a lot of. In a lot of fields of our activities and work and behavior. Now, talking about the vaccine, I'll put it this way: I think that one of the biggest surprises for the medical scientific world was the RNA, the mRNA vaccine. First of all, it's new, and they were talking about it maybe already for a decade, but since the COVID started, a lot of money was poured into this industry, and they managed to create vaccine that at least we are using the Pfizer and the other ones that are using the Moderna, we see such a tremendous results, and the fact that such a vaccine is going to let the industry create new vaccine in a no time comparing to the old methods. I think that it's one of the revolutions of the last year, talking about science.
Well, Rami, sorry, Dan, how fast can the vaccine platform be adapted to account for a new variant?
I'm not an expert. From whatever I heard, I read, I think that they need like few weeks, something like 2 to 3 months, and they can create already vaccine and submit it also for clinical trials.
Do you know if there's because it's already been approved for COVID, or for at least the variants that we dealt with? Is it a different process? I don't know if if you know this, but is it a different process for a variant as it is for the disease itself?
I think that first of all, the only thing that you need is, first of all, to identify what kind of protein you want to present in the new vaccine, and to do a kind of genetical engineering and add it to the vaccine. By the way, the original vaccine wasn't for COVID. I think that they started working it for Ebola.
Oh, for
I
Ebola.
think that they started to work. I think that Moderna, and were working on Ebola vaccine to begin with. So the platform was already exist, but
right.
experience, and now we have already millions of people that got vaccinated with it. So we know much better about the safety measure, the safety envelope of this vaccine. I think that it's going to be the next way that they are going to create vaccine.
Curious, and be glad to hear you, David, and then back to you, Rami. We lost you for a second, David, but you're back. See, if you were sitting here in the studio and you just disappeared and then came back, that would be weird. But
he just like goes into another realm of existence.
This is what happens now that we, everybody's getting used to the world, with COVID, and everybody gets used to the fact that people can just, just freeze their image on the screen and like disappear for a couple of that's
right.
just reality now.
The way it goes.
We heard about Zoom before.
Yeah. It was something that was from sci-fi prior to this. Well, we had Skype, but I'm curious to hear from both of your perspectives. And David, we had you on the show in October, so almost a year ago, back when a lot of this was more new. What has happened since then, since this all came out, that has really surprised both of you? Either things that you were expecting to happen that didn't, or things that you weren't expecting at all that somehow happened. We can start with you, David. I'm curious, and you can go anywhere in the world or in Israel, or in the US.
Yeah, so I think I think this is a really useful exercise, because I think that people have a very easy time deciding that they knew what was going to happen all along. But I think I could list lots and lots of things. So I would start with, I was really surprised at how quickly the variants emerged. And that was because I hadn't been thinking about the fact that for most viruses, you don't have tens or hundreds of millions of infections that allow variants to emerge. Usually, viral evolution is slower than we've seen with COVID, because it takes longer, because every time somebody gets disease is a new chance for it to mutate. And if you have tens of millions of people instead of tens of thousands of people, it happens that much faster. So I think that's one thing that I was surprised about, that in retrospect I think was understandable. Another thing that I was surprised about was the extent to which it seems almost all of the transmission is aerosol rather than via surfaces. Yeah, we and I think when I went on last time, this was much less clear, certainly to me. But it turns out that it's still not certain, because it's hard to figure this out, because you have to figure out what happened, when somebody got it when you're not watching them. But it seems like the vast majority are actually via aerosol. I think the last thing that I will say that surprised me was the world has been talking about how to respond to a pandemic, and people have been warning about this for a long time. And I was surprised at how badly public health performed a lot of different places in responding to something that we knew was coming. We knew, and Israel did a relatively good job, but it certainly wasn't enough to stop the spread when they started out. Not nobody. Vietnam did an incredible job. Australia did a pretty good job after the first round. New Zealand, there were places that did it. China managed to close the country. And I'll say, kind of going back to something that was said a bunch earlier, it's true that China is not at all transparent, but also we would know if there were millions of cases, and there aren't. Like they did, in fact, basically control it. It's not clear exactly what they did and exactly, but it was basically controlled.
Well,
and
it's also not clear what
because,
it's also not clear what the North Koreans did, that they had no cases whatsoever.
Yes, well, there's a great solution for many problems if you can get away with it, that the North Koreans employ, that making things up out of whole cloth, obviously is. But
anybody you want to take up
no, so yeah, but no, I was disappointed at how poorly a lot of different organizations performed at something that they knew was a real possibility and had essentially planned specifically for. That was a.
What
So
surprised
those are my
you?
biggest three. I could go with lots more.
Yeah.
It's very interesting. I remember that more or less the time that the COVID started, there was a new movie about the pandemic coming out, and it's like to sue.
Which one?
I don't remember the name, but it was like people in Hollywood already knew that there was going to be such a pandemic, and it was not one by one, but pretty much predicted at least the very beginning of the pandemic. I don't remember the name. A new one. It was last year, 2 years ago.
I'll have to look it up.
I think that I agree with David on maybe that was the biggest surprise for me, the way that some countries, Western.
Are you talking about Contagion?
Contagion's not new, is it?
Yeah, 2020.
Okay.
Yeah. I think that was the name. If you didn't see it, look at it.
I lived it.
It's including, I think, also vaccine there.
Okay.
The way that some Western countries dealt with the COVID, let's talk about, for example, Italy or Spain. It was like overwhelming. I was like looking, I couldn't even believe what's going on there. It's going to be very interesting to try to also to research and to make conclusions why some countries in Europe, for example, got it very bad, and some others didn't get it. I'm talking about the first wave.
Yeah. Do we still know why? Like Sweden and all. I mean, why?
I didn't read any articles that were dealing, drilling down and trying to figure out really what happened. Besides the fact that they claim that, for example, the Latinos, the Italians, and the Spanish are much more touchy kind of society, and they are much warmer than the others. But I don't know. But for sure, you saw how they hardly managed to deal with it, even inside Italy. North Italy, that's considered to be the most wealthiest part of Italy, was a disaster area comparing to southern Italy. So it's very interesting to look at it also from this point of view. I think that if I'm looking at it from my, the physician point of view, a lot of technologies or a lot of means that we, for example, in the medical system adopted through the year are going. First of all, they changed already the medical world by us, and this is kind of brought it at least one generation in front of what we were thinking about where we're going to be in these days.
Like what?
Like, for example, seeing patients with video conference, with chatting, with phone calls. Nowadays, the doctors, maybe 50% of my patients, I'm not really seeing them. I'm in touch with them with other means, and you know what? Everybody are happy. besides the fact that we, the doctors, are not so happy because we see much more patients, or we have way much more work than we used to have before. But talking about platforms, the platforms became much better, much more modern. We are controlling also, even if I'm looking about my HMO, the way that we are controlling our patients, I think that it's much more efficient than what we had before.
Medically speaking, is there anything lost by not seeing those patients in person? Are you missing the opportunity to correctly diagnose an issue if they're not in front of you to check vitals and get eyes on them, so to speak?
It's a question that being asked many times during this year, and I don't have really an answer. I'll ask you, like a good Jew, I'll ask you a question. When you have, for example, some chronic drugs that you need a prescription, you really need to see the doctor every 2-3 months. You can see them. You can see him also by Zoom. You can video chat with him. You can get a lot of information many times, not really having him in your clinic.
Correct. Yet there are other times when I feel like I want my doctor to be more than WebMD.
Okay.
So I think,
and I can go see him. In those cases, I can make an appointment to go see my doctor one-on-one.
I find myself many times telling my patients, "Hey, listen, I'm sorry, but I can't really look at your throat without looking at it." Even though there are starting to be also some tools, some means that we can listen to your heart. We can check even your blood pressure and heart and ECG and many other things with your smartphone and some appliances. It's amazing how things are getting into it. And yes, we're learning many things. We're learning what are the things that are there is no way. You need to see the person. And you'll be surprised. Sometimes I need to see the person even to make a judgment if he's in a depression. But there are many other situations that I basically I'm not having any added value by calling him to my clinic and I must see you. I can tell a person many times what to do and what he has, even without touching him. Yes, it's not the conventional traditional medicine that I learned when I was in medical school, but yes, we are learning to add some other means to the way that we are working. Yeah. And the same kind of thing, it's not only by medicine. I mean, look at how many governmental offices started to give some services online. You remember 1-2 years ago being able to submit one form to the transportation ministry, or I don't know who. I mean,
only if you did it by fax.
By fax, yeah.
They love working with faxes.
Remember, we used to be one of the last 2 advanced countries to still use fax. Do you know who the other one was? I don't know if it's true or not, but this is what I understood somewhere. So it was us and it was Japan, and Japan was doing it ironically.
So I wanna point out something that was discussed a little bit ago about why it was worse some places than others, and I think this is an interesting example of something that historians talk about a lot, where there are some kind of crazy things that are just like contingent. It happened to work out that way, and that's why did it happen that way? Well, there was this crazy coincidence. The pandemic relevant one of these is right after World War I, the U.S. President Woodrow Wilson ended up with the flu right when there was the conference to figure out what was happening with Germany after World War I, and he was very opposed to punitive measures, and he couldn't make it. So they ended up with very punitive, and that's completely like just a random contingent fact that like, how would you have predicted that the punitive measures would have led to World War II? But in the spread of COVID was very much a lot, and the severity was a lot of idiosyncratic and weird factors. So the two places that got hit very badly early were northern Italy and Iran, both of which imported lots of workers from the Wuhan region of China.
Interesting.
Why? Northern Italy does a lot of garment manufacturing, which is one of the reasons they're very wealthy, partially because that's been an industry there. People were flying back a tremendous amount, back and forth a tremendous amount, and so there was a huge number of cases before anybody realized that something was going on. Iran also did a lot of there were a lot of flights, but I don't remember exactly what they
Why are
do.
people
But
from China
there were a
going to
lot of
Iran at that pace?
there's a lot of trade. Well, because nobody else can because of the sanctions, but which China's ignoring. No, there was a lot of there were very large outbreaks in those two places before anybody realized that like this was a big deal.
Right.
So it's really hard to control a pandemic once it's spread a bunch, and so they got hit really hard, really early before anybody knew what to do, which meant also that like the case fatality rate was higher because doctors many places learned from what people found out in Italy worked or didn't work. Medical procedures advanced in terms of treating COVID over the course of the pandemic because they figured out what worked and what didn't. So there were a lot of things where I don't think that there's any deep mystery about why it is that northern Italy got hit very hard. I just think that it's kind of, this random fact that the garment industry uses lots of people from Wuhan.
David, as much as first of all, it's not explaining what happened in Spain. That's another country. And the second thing is, if I remember, a lot of connections were between Taiwan and Wuhan. I mean, because Wuhan is also a center for electronics, and Taiwan managed pretty well to contain the pandemic.
Taiwan's been ready for a pandemic since SARS. They've been very, very worried. They started masking very early. It's not that these are kind of unexplainable things. And yeah, Spain is an outlier. And if you were to dig into it, I would be very surprised if you didn't find kind of specific idiosyncratic factors that explain a lot of what happened. There are going to be, some of them are going to be things like people being, more touchy-feely in some countries than others. Some of them will have to do with how much time people spend indoors versus outdoors in different countries at different times of the year. There are a lot of actual kind of hard to figure out in advance epidemiological factors that are going on. But I don't think that it's kind of I've heard people say, well, there's no way to predict, or there's no way to understand why it was worse some places than others. It was worse some places than others for very understandable reasons. We just didn't know about them beforehand.
We early on, I remember, it seemed Europe was getting hit really hard, and India, for example, or throughout Africa was not. And now it seems to be the case that India, last time I was paying attention to it, maybe about a month ago, was hit incredibly hard, and they don't have nearly as many, or even close to as many vaccines as they need now. Sub-Saharan Africa. So what happened in those kind of countries that are globalized? People do travel, that don't have the public health systems that we do,
or Japan, which is terribly strange. That they seem to be, so low in their vaccination rates, yet they're in this Asian area where they do have high levels of masking, and it's a part of their culture. It seems to also look.
Japan just screwed up the rollout. I'm just straightforward. Like they didn't get the doses they need as early as they could have because they didn't buy them, and they didn't put things in place to distribute them as quickly as they could have. The same way the U.S. did, except that the U.S. had the advantage of having bought all of the doses really early. But yeah, the reason why they don't have vaccines is because they screwed up there.
But why were some countries like India for example, seemed to be okay. And I remember, people were talking about the climate, people don't use air conditioning as much, so the windows are always open, all these things. And now India got slammed, completely slammed by it. So why not early on? And now you're seeing some of these countries getting hit hard.
The only
So
thing that I
part
know
of
about
this,
India is that now I think that I read that they reached something like 60% immunity between vaccination and people that was sick. There was something that was published a week ago, or something like that. We don't know. I mean, you're talking about India. There was a time that I thought that somehow maybe the Oriental has kind of a natural immunity for COVID, because you didn't hurt so many countries in the Far East that were
Right.
hit strongly with the pandemic.
Right. You're talking about countries like Vietnam, which you mentioned, David, and
But
India and
you see,
Thailand.
you see that besides China, today you have problems basically in almost every Far East country.
So caught up to them. So what happened that it didn't get there early and now it is? I mean, that's if I'm asking the question correctly.
so
You go ahead, David.
in India, I think, yeah, there's one part of this is in India, they tried really hard early on to shut down, and they were at least partially successful. They were in some ways lucky that the people least able to comply with shutdown orders were in rural places that weren't as crowded, and they worked outdoors. So it seems like they were actually successful in shutting down to reduce transmission. They did a lot. Their public health system did a lot of work to try and control it. They couldn't keep that going long term. You know, as Israel, as the US, as everybody found out, you can't shut down indefinitely. And you know, I think there are definitely kind of factors that relate to when and where people spend time indoors and which variant we're talking about, because Delta clearly does spread more quickly. But part of it is just they did a better job early on. I think Australia is kind of the opposite, where they did a relatively bad job very early on, and then decided to get serious and like just told people stay indoors, like don't go outside. And it turns out that if nobody's in contact with anybody else, there's not very much transmission.
David, one of the things that you said to us in the previous episode that we did with you was that if you are looking at this from the perspective of risk management or catastrophic risk management, one of the things that you would recommend to governments to do essentially is to just throw obscene amounts of money at the problem. Because if you're looking at losing X percent of GDP due to a virus, you need to counteract that. And it makes sense to spend $1.5 trillion on developing technologies and developing awareness and doing whatever that needs to be, what needs to be done. So I'm wondering, where do you did we do that well enough in the West? And then kind of from my own perspectives, we've talked about this before and I talk about it ad nauseum on the show. It's like, because I work in travel in my day job, I'm uniquely impacted by this in many ways, but I also see that there are, technologies that might exist which could make it easier for people to more normally enter and exit countries, that either the rollout of them in Israel is just done ineffectively or isn't done at all, or perhaps it gets caught up with politics, but it also seems like maybe the resources aren't going there because, the pie is still being divided up if you're playing by the rules of the old game as opposed to the rules of the new game. And then maybe kind of just, again, we're talking about a virus that seems to be changing in terms of how fast the variants are spreading. And when you have to develop a new vaccine or tweak the vaccine so often and get that out there and the distribution of it to all these different countries, many of which today are not even receiving the first vaccine, how can we throw more money at it, I guess, to make sure that that it's being handled adequately?
Yeah. I guess on the first thing, did we throw enough money at it? No, we definitely didn't. We did a better job than a lot of people initially suggested. So I mean, in the U.S., the Trump administration's kind of plan to just go all out for vaccines was more successful than people suspected it would be. As I said last time on the episode last year, we should just start building vaccine factories all over the place and like just have tons of doses ready to go for whenever it is that like we get the vaccines. And this was before we knew how effective the vaccines were or whether they'd be. And the point was, if we had thrown another couple $2 billion at building the vaccine factories, and that's not a little bit of money, but it's not a huge amount compared to what countries were spending.
And
if they had done
how much
that,
they were losing every day also.
Right. If we had done that, we would not be at a point where, developed countries are just now getting to the point where most of their population is vaccinated and developing countries are still kind of just getting started. We could plausibly have been 6 months further along because we started paying for it 6 months earlier. I think there are lots of other places where spending more money on the problem is just the straightforward, correct thing to do, whether or not it's wasteful, and it probably would be, whether or not it's kind of the economically optimal thing to do. And yeah, that's hard to calculate. So like, don't spend your time doing that. Just throw money at it because it's a pandemic. The other side is we actually did throw enough money at the problem in the US and to some extent in Israel to cushion the economic impact, which, I'm not going to get into the economic theory because it's not really my area, but like the recession was incredibly short. The recovery was really so, and things are really getting back, even though there are industries that are still hurting very badly. We came out of this economically much less badly hurt than we could have been.
And I think that's one of my surprises is that
they actually. So the other side of this is recent U.S. news. They're talking about cutting the spending on pandemic preparedness from $30 billion to $5 billion in the infrastructure plan. And the comment from everybody I know in public health is, what is it going to take to convince people that we need to spend on pandemic preparedness? Because we're literally still in the middle of a pandemic. Like, and you're talking about, we're going to spend $1 trillion, but like 0.5% on the thing that we're still dealing with, that should be enough. It's just insane that they're so reluctant to spend money on the thing that I think everybody should be pretty clear, like, was a great investment to the extent we did it and would have been better if we tripled or quadrupled or quintupled our investment.
I didn't know that. That's insanely stupid.
Lenny, I think.
Well, this is still like being discussed. So maybe maybe that's not the final decision. But yeah, yes.
Rami, you want to jump in here?
I think that could be that one by the name of B. Netanyahu heard your sixth podcast and follow it. At least talking about spending as much as you can, but spending money and getting the vaccine. So there were a few people that did the right thing, at least talking about treating the situation. I don't know so much about the economy because I'm not an economist, so I don't know about so much. But he's an economist.
BB the economist.
Yeah, exactly.
Right. BB the economist was the one who figured out that, yeah, by the way, money fixes this problem.
And not only that, spend a lot of money now and save afterwards from all the the damages that you saved that are not going to happen.
Oh, and maybe it'll get you reelected also, right? So,
but maybe it won't.
Almost so close.
But
so close.
We're gonna take your comment, Rami, and we're gonna pretend that BB listened to our podcast and listened to David's advice and and followed it.
I'll take credit.
Yeah, take credit.
We're happy to pretend also.
Sure.
Do you think No, go ahead.
No, please.
No, I was just going to say that. Do you think that we're going to find a way going forward? I always like to hear your predictions, and Rami, I'd hear your prediction as well any day. Do you think going forward we're going to hit sort of this magic sweet spot where we're able to develop vaccines efficiently and get them distributed efficiently enough to stay ahead globally of any new variants that come out, like we might be able to do, let's say, with the flu or with other things that we vaccinate for?
I think that I'll
Um,
respond first. um, if there is a disappointment, talking about global disappointment, I think that it's the World Health Organization that really didn't really work till now, and I think till now it's still not doing its job. And when you're talking about distributions of vaccine, you need first of all to have an infrastructure that can distribute something like that. You are talking about billions of doses for hundreds of countries. It's not such an easy thing. I think that at the very end, still money talks, and still we need strong countries and with their money to first of all to spill the money into the industry to create the vaccine and to create medicines. And probably we are going to still see that first of all, strong economies like United States, like common European market, hopefully also Israel, are going to get their vaccines and medications before the third war. But the question is, if we are really prepared to spend money first of all, and to create an efficient system of distribution of those cures also for those that are not so wealthy, when we'll understand that it's a global problem, and if we are not taking care of the last person in Africa or in Asia, and we are vaccinating him, so we are also in a danger still. So we are going to still suffer from it.
Yeah, I think that that's right. I think I strongly agree. I think that there's an imperative here. I definitely think the World Health Organization gets a share of the blame, but I will say they put COVAX together and said this is how much money we need to fund vaccines for the rest of the world, and the U.S. passed stimulus after stimulus and couldn't. And they gave some money to these organizations, but the amount that the organizations said they needed to do this was an order of magnitude larger than what they eventually settled on as their target. And what they, and that was still double what I think they ended up getting. COVAX never got the funding still has not gotten the funding that they need to distribute the vaccines, which is crazy given that we do know that the variants are still continuing to emerge. So I'm not super optimistic about the world's willingness to be nice and help their friend out, even when it's helping themselves out doing so. I'm very much a techno optimist in terms of the vaccine development, and I think that.
Is that a new word?
Well, I
We
mean,
learned a new word.
look,
Techno optimist.
Techno optimist.
It's a new word.
Yes.
We like learning new words.
Okay.
On the
show. The mRNA vaccine platform is incredibly powerful. There are a lot of things that are being discussed. People are already looking. I know people who are people at Oxford are actively working after the COVID vaccine that they managed. They're actively working on a universal flu vaccine. People are actively working. There are a lot of vaccines that are really getting there. And I think that Rami is completely on target about the need for distribution networks and getting it to the people. My hopeful piece here is we've done this. The world got rid of smallpox smallpox is a past tense disease, which is an amazing, amazing, amazing thing. Just like thinking about what that means. Polio, we're getting close. We're not there, but we're getting closer and closer. Like we can wipe out diseases. The world has done this, and I think we'll continue to do this. And I think that the availability of new vaccines that are able to do this are, the question is how long it takes and how much effort is needed.
Right.
I will say, on the timelines for getting the vaccines put together, the UK made a proposal at the G7 meeting, I think, with a 100-day timeline. A number of senior people in the Biden administration, the head of White House OSTP, has endorsed this explicitly as like, yes, we should, starting day one is we find a new disease. By day 100, we should have diagnostics and vaccines ready to go. I'd like it if part of that 100-day timeline was scaling up production also, going back to my.
So if I understand you correctly, just because the layman here trying to understand these kind of things, if I'm understanding correctly, we kind of got the science right, and now the challenge is the global distribution network. And I think what we're not saying that makes it even harder, correct me in a second where I erred on that, but what makes it even harder is the need, at least with this kind of vaccine, to refrigerate it to, what is it, minus 60 or minus 80 or whatever it is Celsius. That makes it so much more harder to distribute, and that it has a shelf life, and you can't just put it in the back of trucks or whatever and distribute it. Is that the challenge now? Though we kind of have the science, but we don't have the infrastructure. Go ahead.
There are a couple of parts. The first one is cold chain distribution networks are the kind of difficult challenge that we actually know exactly how to solve. It's a little bit expensive, but not so expensive compared to all of the other things that we're talking about doing. Putting it in place is hard. Putting together any infrastructure network in developing countries can be very challenging, but also it's the kind of thing that just needs funding. And tell Amazon that they need that. Yeah, I'm saying, like, tell Amazon that we're going to pay them what it costs to get the vaccines to people, and they'll figure out how to do it. Tell FedEx to do. There are people who their job is to figure out how to do global distribution of things, and they can do it. Actually, very nice in some ways,
in Israel they did a great job with it, right?
Yeah, even when we are talking about the cold chain, the success of sending a small amount of vaccines. They did a very good job with it.
I'm curious.
Yes.
I want to change.
It's doable.
Yeah, I want to change gears for a second here.
Go
ahead, Dave.
The piece that they haven't figured out, which is critical, and we know how to do, but nobody's quite there, is testing and approving vaccines that quickly. And there are ways to do that, including human challenge trials, which I'm a big proponent of, and I can talk about that ad nauseum, but I won't. But there are ways to get that done, and in many ways, the biggest challenge is not the technology, is not designing the vaccines. It's iterating and producing them and checking that they work.
I guess I have two. I had one question, but now I have two. Your comment there sparked another question here, so I'll ask the easier one and then the harder one. Did we get better at testing for COVID? Because nobody's talking about that anymore. I remember at the beginning, and I think maybe when you were on the show, David, we were saying, why aren't there quicker, almost immediate tests? And I keep hearing that they exist out there, but instant or near instant, or tests that you get back within an hour, cheaper tests that you can do at the entrance to places. It seems like now that there's a vaccine, nobody's talking about ramping up the ability to just test people really, really quickly. And I'm wondering what happened to that, or am I just not paying attention to it as a citizen? Do you in the medical or the policy community here?
Both.
Are you guys talking about it, Rami?
First of all, there are kits of vaccine check that you can get results in 15 minutes and
15
minutes.
Are they affordable?
You are right now in the States. How much it's going to cost you if you go to 7-Eleven, you'll buy one?
It's true. You could probably buy one for about $30.
$20?
Yeah.
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 And they're already on the market?
Yeah.
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 Yes.
The,
So part of the reason you
that-
didn't notice is because we solved the problem while we were getting vaccines. We kind of solved that problem
Aha.
most of the way, kind of.
But if you are looking at the technologies of discovering and giving you the information of who is sick and who is not, you need to know also that always, as long as you are going to go low to the low tech, to the kits that are giving you results in 15 minutes, you are widening your margins of false negative, false positive, and you need to create your own policy. How to deal with it. For example, in Israel, if you are doing a fast track test and you are getting it positive, it's not necessarily that you are really sick. You need to do a form of PCR, because a form of PCR gives you a 95, 98, even 90, 99% assurance that you are really sick, and that's a very good test to do.
I'd be curious to talk to you
Um,
guys about anti-vax
I-
culture. Go ahead, do that, and then we'll talk about anti-vax culture.
Before that, and that's another one that I can spend a lot of time on. There is, and the link is available for this report, but there's a new report I helped on about how it is that you would do early warning systems, and there are technologies that we're developing now that are very general for detection. If you like new words, metagenomic sequencing is one of these new technologies that, yeah. So basically you can take a
I'm a
sample
linguistic
and just
optimist.
figure out what. Yeah. No, you can take a sample from somebody, and instead of testing whether COVID is there, just sequence, like get DNA sequence data on everything that's there. And then the task is a computer task of, filtering out and figuring out what exactly is there. And it turns out that computers are super fast and they're getting faster. So like that's a better problem to have. So there are technologies that we have and are continuing to develop that in the future will make this even easier. That there are a lot of technologies that kind of, so we figured it out for COVID, and we have the rapid tests and we have the PCR tests that are going faster, even if they're not, even if capacity in many parts of the world is still very limited, but we also have kind of the next generations of technology that are even more powerful and can be even faster.
So I want to switch gears for a second here, and I'm just curious about this whole anti-vaxxer culture. Why? Why are people? I mean, we have the short answer, but we have time to get into it. And then I'd be curious, do you meet these people, Rami? Do they come to you? Just can we get into their mindset a little bit? Who are these people? Why are they so, against this vaccine? Is it just because it was developed so quickly and they're suspicious? Is there, maybe we'll start with Rami. Just on
They don't want 5G, Dan. They don't want 5G.
5G, and then David, if you want to kind of take that afterwards, and we can spin off onto this one.
Well, in Israel, we don't have so much those 5Gs, but we have a group that it's not homogeneous. It's like people that comes from very different way of thinking. And I'll tell you the truth. I find it very hard to speak with them. And most of them comes with plenty of knowledge. The knowledge, it's what I'm calling a semi-scientifical or pseudo-scientifical. And if you are not really so much on it and you know all the data and information, you find it very hard to argue with them, and it's exhausting also. You don't have, in the 10 minutes that the doctor has, you don't have the time for it. So I'm not fighting with them. You don't want to vaccinate. Okay. You don't want to take, I'm offering you, I don't know what, antibiotics for your strep throat. You don't want to take. What can I do? I'm only telling you what are the possibilities and what are the dangers that you are putting yourself and the others. I'm much more strict about people that are coming to the clinic, for example, without any mask.
Can you ever just say to them, Rami, like, which one of us here has a medical degree? Which one of us doesn't? And doesn't that count for anything anymore? Can you be direct with people and say, listen, I understand that you feel a certain way because you read some stuff online,
No.
and what you read might be okay, but really, you didn't go to medical school and you're in over your head.
You haven't been in a medical in a clinic in quite a bit, hey? You don't understand that
I'm a
today.
pretty healthy guy. I don't know.
Today, when we're talking about politically correct, you can't really say to your patients, hey, listen, I'm the smarter and you are whatever.
No, you can't say that, but it's also implied in that I'm choosing to go to a doctor and not to a witch doctor because I want something treated, and therefore I want to go to somebody that I hope knows a little bit about medicine.
No, doctor. I read it in the internet, and that's what I want. I want you to write me a prescription for whatever I want, and don't start to convince me that I'm going to die or I don't know what.
The internet, man.
It's a whole different ball game.
Go ahead, David.
So this is the risk communication, the health and risk communication piece. We know a lot about how to talk to people about risk. We know a lot about how to talk to people about vaccines. Vaccine hesitancy did not start with COVID. Unfortunately, people have been dumb about this for quite a while. But I want to kind of be very clear about something. Not everybody, most of the people who are not vaccinated, who are not getting vaccinated now, are not what we normally refer to as anti-vaxxer. They're mostly what we call vaccine hesitant. And what that means is they have a lot of uncertainty. If you have to make a decision, look, there are a lot of people out there who say, like, look, I have a headache, but like, I don't really need an Advil. Why would I take a drug if I don't need to? And this is a drug. Like, why are we sure that I need to take it? And the answer is yes, but you need to be clear about this in a way that's kind of not talking down to them, but also explains and answers the questions that they have. And people have, I think, legitimate concerns, that addressable, but legitimate concerns about, well, wasn't the vaccine rushed? And the answer is yes, but not in ways that compromise safety. And I can go into details about exactly how they did that and what they parallelized and what they didn't parallelize and how they, didn't wait to do phase 2 and phase 3 studies for multiple years the way they normally do when they're doing this. And that doesn't mean they did the studies differently. It means that they, cut through red tape. Like, there are a lot of places where legitimately people said it was supposed to take 5 years and we have a vaccine in a year. How do we know if it's safe? And they have confusions, some of which are, I think, spread by some certainly maliciously, and I'm not going to talk about kind of information warfare, except to say we do know that Russian disinformation has been very active in spreading vaccine misinformation before COVID and now. We know that.
I'm shocked.
No, I mean, I know the Russians have been spreading political disinformation to weaken the fabric of American society, but why?
That vaccine,
basically
to collapse America, to collapse the West.
Not only America, the West.
They pick anything. They pick anything that they can get people to argue about, and vaccines are one of them. I don't think. I mean, like, maybe I don't think the intent, to be down the Kaskos for our Russian disinformation people. I don't think that the intent is to get people to die. I think it's just to spread more dissent inside of the U.S. and everywhere in the Western world. But so that's the source of a lot of this information. But when somebody sees in their Facebook feed that 6,000 people died after getting the vaccine, that's a scary number. And when they click on the link and they say, look, US government documents, there's, the reporting system says that 6,000 people died. And that's actually the number that's in the system.
Yeah.
Well, that sounds scary. And you can explain to them that, yes, 6,000 people died. These are elderly people. It doesn't mean they died in any way related to the vaccine,
Right.
but the legal requirement for the type of conditional approval that the COVID vaccine got is that you have to report anytime anybody died. And there's a line from Family Guy that I like quoting about this, which is, somebody says, do you want to, a used car, and Peter goes, oh yeah, I'd never buy a used car. I know a guy who bought a used car. Bam! 10 years later, heart attack.
Yeah.
I'm like what's the but that's the level of connection you're talking about when you
Sure.
say like, so, theirs has incidents of somebody got the vaccine and then was hit by a bus
Right.
and they died. That wasn't, maybe the vaccines make you magnetic. Like, there's no connection.
5G.
5 years old and they had a
so-
heart attack. It's like, right.
Right. I'm saying so. Right. So there's a lot of, but when presented, by people who have an agenda, it can look really scary. And I think that it's important to try and address that. And I think that, you need to do it in a way that actually addresses legitimate sources of confusion among people who are smart and well educated and not doctors and not public health people. And that's okay. Like,
Yeah.
computer programmers aren't supposed to be public health people. They're smart people. You should address their questions. Doctors don't have hours to spend debating this.
Yep.
It's a problem.
We had a guest on the show from the Haredi community here. And we, we were talking to him about other things, but we talked also about COVID and his, I don't know if you recall this, Benny.
You're talking about
the episode with Guy Madelon.
Yeah.
Dr. Rabbi Guy Madelon, different kind of doctor. But he brought up an interesting point in that, we were talking about in the Haredi community, they're actually in some ways more willing to listen to the government and medical professionals because they're not scientifically educated. And if you're slightly scientifically educated, then you think you can go online and self-diagnose and be smarter than the doctor versus those who just realize they aren't, scientifically literate. So they just listen to what the government says. So it's kind of almost counterintuitive that a little bit of education in some cases might not be better than no education.
I must tell
on
you
these issues.
I must tell you that without generalization for the whole community, but as a religious Jew, I was very, very surprised and disappointed from the attitude of the Haredi community. Talking about the whole year of the COVID. By the way,
Yeah.
not only here, not only in Israel, also what happened in New
New
York,
York, yeah.
New Jersey, in all the Haredi
England.
Yeah.
Yeah.
England, yeah.
And I till now I don't understand the psychology, and I don't understand how they came to such a behavior, because it's so much not Jewish, but it happened.
Yeah.
That's all.
No, it was a fascinating development to watch unfold and to try to understand it and try to talk to people from within the community also to try to get their perspective on things, which we tried to do on the show, and also things that I did off the air with people who didn't want to go on the air to talk about these trends. Curious for a second, and I don't mean this question to be political in any kind of way, so let's not go there. But we had, in the midst of the treatment, at almost similar stages, changes in administrations here in Israel and in the U.S. And I'm curious, just on a very practical level, did either administration that came in, we're talking, of course, about the Biden administration first, and then, of course, this new Bennett-Lapid government, are they doing anything different practically, not rhetorically, than their predecessors that are more or less successful in handling the pandemic? And of course, here we got vaccinated earlier, but just if we can use it as a platform without bashing one government or the other, or overly supporting another, just on a very practical level.
David, you want to answer?
Um, I'll answer for the U.S. because I'm actually more closely involved with the political developments there. I think that President Trump should get a tremendous amount of credit for funding the vaccines and getting them done quickly. And I agree with him on very little, but he should get a tremendous amount of credit for that. And it's I can't even begin to describe how amazing it is, and all the tens or hundreds of thousands or millions of lives he is responsible for saving by having done that. And I think that another administration probably would not have gone all in for that. And I think that it was, completely 100% he gets credit for that.
In bureaucracy also.
His administration was not able to manage a lot of the other things that were critical, including building distribution for the vaccines. That was not planned out. The Biden administration came in and managed to do the distribution. It wouldn't have mattered if they didn't have vaccines, but they got that right. It was critical. It was very important. And other than that, I think the Biden administration has had very, very little ability to change the public discourse or impose rules about almost anything, for reasons that Benny was talking about at the beginning. Like, Americans aren't interested in the same type of thing. So I think that there's a limited amount that could have been expected for him to do that. I think that there are things that he's doing well. There are things, but I don't think there's anything that you can say like he got everything right about how to respond, especially because he came in so late in the game. But Trump should get credit for funding the vaccines, and Biden really should get almost all of the credit for getting the distribution to happen pretty well. That's the U.S. In Israel, I'll say clearly Netanyahu should get all of the credit for buying the vaccines very early and pushing for that to happen.
Yes, I think that
if there's anything else.
I think that in Israel, it's very, very early to make a judgment about the new government. Even the story of the Delta variant that came to Israel to start to judge the way that the new government is doing it. They're still in the learning curve. You can't really make such a conclusion. And I'm pretty much agree with David. As a matter of fact, Trump did another thing, something else. He also cut the bureaucracy. I still remember in the last few days of approval of the vaccine, he came to the FDA and told them, stop playing around with bureaucracy. Yes or not, and go for it, and I give you 24 hours. That is something that it's absolutely an unusual thing with the FDA. And talking about the distribution, I'll put it this way. For sure, Trump administration brought like a new wave and a new approach, and I think that a very positive one. But I think that he had already quite a bit this distribution plan and system set up for when he came into the office. I mean, Trump was not in the mood of forcing people to vaccinate, but it's not that he was anti.
Right.
So I'll say on the pushing to reduce regulation, you're right. He did push to reduce regulation. My only disappointment there is that when he came into office, it was one of the places that he said he was going to reduce regulation a tremendous amount. And it took till the very end for him to actually manage to push them on this. I was disappointed in how little he deregulated the FDA. He should get credit for pushing them to go faster on some of these things.
I will go ahead.
Yeah,
No, go
no.
ahead. I don't want to interrupt your train of thought. I was
I
going to change something.
Well, I was gonna move over to Israel, where I think the only thing I would add to those thoughts is the last time I was on the podcast, I pointed out that in some ways the biggest problem that Israel had was when you have a government, there's political pressure to do things, and when the health ministry is in charge, they just make the public health decisions. And when people say, but shouldn't we reopen? And do we really need whatever? They're like, we don't care. We're doing what we think is the best decision. And they don't respond to political pressure in the same way. And I think that not because of Bibi in any way particularly, just like when you have a political government, then there are different kinds of pressure that make it harder.
That's an interesting point.
I don't know how that is playing out now.
One of the things that that I've noticed, and I think that is talked about a lot here in the States, at least, is that in the early stages of the pandemic, you could, because of Trump's positions on things, and particularly on China, it was politically incorrect in many circles to come out and question the origins of the virus being anything other than the accepted narrative of coming from a bat in the Wuhan wet market that was infected by eating a pangolin 1,000 miles away, and not acknowledging the fact of the Wuhan Institute of Virology being literally 3 blocks down the street. And now that Biden has taken over, there's more of a legitimacy to question that in public, or for the mainstream media to talk about it, or for people to talk about it at home or in social circles. I'm just curious, from both a catastrophic risk prevention perspective and from a medical perspective, does it matter that we don't have clarity on that now? And where might we be if we did? And we also had a guest on the show, Sarah Wilf, who Dan will remind me the name of his organization.
Root Claim. He has a company called Root Claim that uses advanced mathematical probabilities to determine the origins, or of different world events.
Right. So we talked about origin of COVID with him. I think it was last. Correct me if I'm wrong, Dan. Maybe last December or November. And it was clear to Root Claim that it was a lab leak, and not
inadvertent. He said
inadvertent lab leak. So now that we're a year and a half into this, what are your thoughts on that, gentlemen?
Yeah, maybe you can go first. I have plenty to say about this, but I need to plug in the computer first.
You know what? It's very interesting. Since for a very long time, I'm interested, in epidemics and things like that. So I used to get the CDC notes, like bulletin notes all the time, and I think that I was one of the very, very few people in Israel at the beginning that heard about this very strange virus that goes in China, and that the Chinese already are very much in alert and everything. I don't know how much it was going to make a difference, or it's going to make a difference if we'll know that it leaked from a lab, or it's a kind of a natural virus. We know that that we are humans, and humans make mistakes, and labs are tending also to make mistakes. So it can happen, if not in China, it can happen in the States, in Port Lead or Mead, or somewhere else that they are dealing with viruses. And we know that they were leaking also before. The question is how you are reacting. And if there is something that I think that we can really say about the Chinese that they didn't react well, was to be honest enough to spread the news as fast as is possible to their medical colleagues all around the world, that the world will be able to respond, and that they didn't close also their borders in the right time. I mean, you were talking before about, for example, about Iran. The Iranians had flights to Wuhan on a daily basis for a month after it was still already in a shutdown. They didn't really give a damn about the whole world. That's my conclusion. If you really want to contain such a leak, you need to be see-through. You need to be honest and to give all the information as much fast as it's possible to your colleagues.
Yeah.
So I guess I'll start with root claims analysis tries to do something. I think that it gets several details importantly wrong. I think that it's overconfident in its conclusion. There's one way that we could know what it is that happened with the origin of the virus, and that is at some point we could find the natural origin, the kind of reservoir in nature, and we'd be able to look at that population and find the kind of related viruses. And there are ways that we could conclusively prove that this was natural origin. If that data is available, China would really like to be able to talk about it, presumably. And they either haven't looked very hard, even though it seems like a super important thing for them to have wanted to look for, or they've looked really hard and they haven't found it. So that seems like really pretty strong evidence that, like, if there was a natural origin, then they're not finding it. And on the other side, if it was a lab leak, intentional or not, I'm effectively certain that anybody who could give any details about this is either a senior person in the Chinese Communist Party or is no longer with us. Just
or has mysteriously disappeared.
So I think, yeah, that's a generous way of putting it. So I think that said, laboratory safety is a big deal. I have been talking about this and thinking about this since before a while before COVID, and I could talk a lot more about that. But yeah, we need more transparency. Science is based on transparency. It would be wonderful if people were as transparent about their mistakes as they were about their successes. I think that it's critical. I think that this isn't just a safety issue. This is a kind of basic, kind of what we should expect from our scientific institutions. And in Israel, there are some guidelines for reporting laboratory-acquired infections. In the U.S., there are some; they can be strengthened, but there are kind of some guidelines around this that should absolutely be strengthened. A number of people have asked, does it make a difference? And the answer is, for COVID, not in any significant way, but more generally, does it make a difference? At this point, kind of not, because we know that it's very, very plausible that it came from a lab, and that's enough to tell us that we should take this super seriously. And if it ended up actually coming from a lab, that conclusion shouldn't change. And if it ended up not coming from a lab, that conclusion still shouldn't change. If this is a plausible route, and we've said that it is for a long time, if this is a plausible route to a pandemic, we should be really careful about it.
Does that mean stopping gain-of-function research in labs as a method to develop?
Research. Yeah, gain-of-function research refers to a lot of different things.
Right.
And it's not, it's not like across the board, anything that could be called gain-of-function is necessarily dangerous. But I think the bar, look, there when the debates about resuming gain-of-function research in the US were happening, when the original debates about stopping gain-of-function research were happening, a number of labs said, look, our lab is safe. We don't have accidents. And I don't know, you guys may not remember back when you were in college, but there are college students working in these labs. And if you believe that nobody has ever done something stupid in one of these labs or dropped something or tripped, you're crazy.
Right.
Like, and if you talk to people who work in labs like this, they have stories about what, you know, the funny / terrifying things that have happened in labs that like we're working with kind of dangerous organisms. Yeah, there's the bar for doing research on things that have this kind of risk should be much, much, much higher. That's not to say nobody should ever do research on Ebola, but you know, when people talk about, oh, well, we're doing research on anthrax, and the question is, could you do it with a different spore that like is very closely related but doesn't kill people? And their answer is, oh, maybe, but it'd be harder to publish. There's something deeply unethical about doing the research on something that's more dangerous because it's easier to publish your results.
Nature in the modern world. And on
Well,
that,
I want to wrap this up with a light question, but as with our previous episode, that's proving difficult to do. So maybe I'll just ask both of you, you know, as we are, and as I, you know, look at the world outside me here in America, and as we experienced in Israel over the last year, you know, things gradually opening up to a place where we feel more confident in our ability to live normal lives. You know, how optimistic do you both remain, and what predictions do you have maybe in store for us in Israel and in the States in the year to come?
Techno optimistic.
Yes.
Who wants to jump in?
I guess I'm up first.
Go for it.
So I will say over the, maybe not the next year, but over the next 5 to 10 years, the good news is, I think, you know, as a kind of reaction to COVID, we will never have a period of time where people are as reasonably cautious about emerging diseases and as willing to react to make sure that this doesn't happen again as we will over the next 5 to 10 years. So, you know, I not that this isn't still a risk, but I think that we're in a great situation for at least a little bit in terms of dealing with that. And I think we're in a great position in terms of investing in making sure that we're better prepared for next time, at least for the next 5 to 10 years. Over the next year, I think people are continuing to get more used to the fact that COVID is not gone as a risk, and people will continue to deal with that. I think that we'll continue to push to get people vaccinated. Somebody mentioned before that we should talk about whether we should be vaccinating children, and the responsible scientific answer is we need to wait until there are comprehensive test results. And my personal response is, are you kidding me? Why are we not vaccinating children? But that's a separate discussion. I think that
David, if you could vaccinate your young children today, would you?
Yeah, no question. But I will say the next piece is we're going to get the evidence pretty soon. The studies are ongoing. We're going to find out, you know, kids 6 and up, and people are going to start vaccinating them, and we're going to get to the point where Israel will have near complete herd immunity, and we'll continue to see variants. But I think that you know, the risk is so much lower and will continue to be there that we'll get used to it, and the world will move on.
I would say that I'm pretty much optimistic. First of all, we had the vaccine that created already in the States, in Israel, in a lot of the Western world, ready to fund the foundations of herd immunity, and I don't, even though there are all the time variants, it's still corona, and still there is going to be at least a partial immunity, even from the very, very basic immunity vaccine. But my optimism, it's something else. I see in a matter of few months, that's my opinion, that we are going to have few medicines that are pretty good on taking care of the severe cases of corona, maybe even preventing people to reach to the stage of severe cases. There is at least one Israeli company that had a drug dealing about it. We didn't mention anything about what we call the long hours of the corona. All those that suffer
Long
from
COVID.
the long COVID. And this is also something that is being addressed, and they're trying to find some medications to treat it. One thing for sure, the corona taught us that humanity, when we are making a decision about reaching a target, and we are gathering forces from all around the world, and we're spending the money, we're succeeding to reach tremendous amount of advance in a very, very short time. By the way, some of the medications that they're talking about now are going to be good for some other viruses like AIDS. Some of them are going to be very good even for treating different types of cancer. So probably in a matter of a year, you know what, I won't be so much optimistic, but few years from now, we are going to look at this year as, first of all, as a year that all of us were in a kind of a jail and nut house, but that it also gave a tremendous amount of forward step to science and to the public health when we're looking at it in the long range.
Fantastic. That certainly is a more optimistic note to wrap up what could often
Most
be
definitely.
a conversation.
Definitely. So, guys, thank you very much for joining us. Always a pleasure, David. Very great to meet you, Rami. And look, from your lips to God's ears, as they say, we hope that everything turns out for the best as quickly as possible. So, when we're having another repeat episode a year from now, on episode 104, we'll be in a whole other place, and then we can start talking about other catastrophic risks that freak people out, David.
Not about COVID. A year from now, not about COVID.
Not about COVID.
We should be done with this.
Let's talk about
retrospective. We can do a retrospective.
Super volcano in Israel.
Yeah, we'll talk about super volcanoes. We can talk about aliens. We can talk about all kinds of other stuff.
Rogue AI.
AI, of course. We should have an AI episode. All right, guys.
Thank you so much for joining us.
Okay.
And thanks everyone out there for listening to episode, you said 52?
52
of Nuanced, and we're going to have to celebrate the next one. Next time you're going to be here in Israel, and I'm going to be in the United States.
That's right.
Nuanced. So we'll have to reverse the trends here. So thank you guys for joining. Thanks all the listeners out there. Benny, have a safe flight back.
And you have a safe flight here.
Thank you very much. And we will see you all next time on Nuanced.
Bye-bye, guys.
Bye.